Northern Cape will be changed for the better. This as the Smile Foundation completes its week-long program of facial reconstructive surgeries at the Robert Mangaliso Sobukwe Hospital. Children as young as 2 months who were affected by facial deformities such as cleft lip, cleft palate will now be able to boast a smile on their faces. And our reporter Katleho Morapela is in Kimberley for us.
We are at the Robert Mangaliso Hospital in Kimberley, where about 17 children underwent reconstructive surgery this week with the help of Smile Foundation. The foundation is this year celebrating 21 years in operation. And we have been told that in the 21 years that the foundation has been operating, they have helped about 4,000 children. But with me right now, I have Dr. Maria at the Kimberley Hospital, and she will tell us a bit more about this project. Dr. Maria, just tell us, how have you guys been operating this week? We hear that you have assisted a number of children at the hospital just this week alone.
Yeah, this is the sixth Smile Week that we have been since 2017 in this hospital. And this week we helped 17 children. For these past years that we have worked with Smile Foundation, we had 120 children helped. So we do cleft palate, cleft lip, burns reconstruction, and other reconstructive procedures. So it's a joy to work with the Smile Foundation because we have a backlog of operations. So we book the kids, and they are very happy in the ward. The ward also was refurbished by Smile Foundation with other partners, and this hospital has been helped a lot with that. It's a public-private partnership that we have for the past years.
Now, Doctor, you also allude that you guys are dealing with a backlog. Just tell us now, with COVID-19 regulations relaxed, what are you hoping for? Are you hopeful that you will be able to deal with the backlog and perhaps increase the number of children you help?
There is a backlog for all the disciplines in the hospital, and we are trying the best. Of course, that the public hospital has some challenges that unfortunately we cannot overcome quickly. So we try to book patients, elective cases that were not done during the COVID-19 pandemic time. That was terrible for everybody. But we are doing, as soon as we can, all the elective cases.
And lastly, just before we let you go, in terms of funding, tell us a bit more about that. We hear that these surgeries could be quite expensive, hey?
Yeah, remember that the public sector, the patients they don't pay for the operations. So, but the problem is that if there is a delay of the operations because we help a lot of the population that doesn't have medical aid. It's 80% of the population. So the backlog exists, and when we can afford to have in 1 week operation done, it's a joy. Because otherwise these patients would be distributed during the year. We could just afford to have them maybe once a week. So we gather the patients and we can help them. So if we do that in other disciplines, I'm sure that all the backlogs can be helped. The government should look for public-private partnership to overcome the backlog of surgeries caused by, unfortunately, the virus that was here in the country. Okay.
Thank you so much, Doctor, for your time. That was Dr. Maria here at the reconstructive surgery department at the Robert Mangaliso Hospital. She's just alluding that they have a number of backlogs, but they are hopeful that they will be able to attend to them as soon as possible. These surgeries, we know that they bring changes in children's lives and their families. Many of the children often get bullied at schools, but with the help of these doctors behind me, they bring a difference in communities and in families.